Thanks everyone for joining. I'm Raghu Apasani. I'm the founder and CEO of the Minds Foundation. We are a mental health organization that's been around for almost a decade now. And our primary goal is to try to create a world where people regain empathy and compassion, where no one, despite where they are in the mental health spectrum, feels left out or alone. And we do that by focusing on increasing literacy around mental health and also access to care through capacity building. And so part of that is now in the time of COVID, using virtual platforms like Zoom to try to continue to deliver education that is really based on storytelling and psychoeducation. So thanks for joining us. I know we have a lot of folks who have been to a few of our prior events, so thanks for the continuing support. Today, I am particularly honored to, not only for the panelists that are here, but also for our moderator, Dr. Doug Zadonis, who's been a mentor of mine for many, many years now. I met Doug back in, I think I can call you Doug now, back in medical school in Boston at UMass Medical, where he was the chair of psychiatry there. He, during his time there, grew the department to be the largest psychiatry department in the country. And so needless to say, I think I'm pretty well trained because of that. Prior to that, he spent a lot of time on the West Coast at UCLA, also at Yale, where he received an MPH degree. He's internationally recognized for his work in co-occurring mental illness and addiction, especially when it comes to tobacco addiction and recovery-oriented interventions. He's had many grants over the years, many, many publications. I've been honored to write a publication with him as well about the dignity of in mental health. And you guys should all Google him because there's a lot to say, but I think one of the most interesting things and what I really appreciate about him is his continued support of his mentees and his trainees. And so he's one of the reasons that I actually moved to the West Coast to train, in Southern California. And he continues to be a guiding light for me. And he is very, very into mindfulness as well. And just a very quick fact here, I never met him until I had him as a lecturer for one lecture in medical school, and he walked in playing a Native American flute. And so that was a very unique entrance, and it was a very amazing lecture. And for the past few years, Doug moved back to the West Coast. He is a associate vice chancellor at UC San Diego Health, and he also oversees and is spearheading the development of the School of Public Health, and works to really bring UCSD and mental health into the global spectrum, and has done a lot of work in Latvia and Eastern Europe and all over the world. So on that, I will hand it over to you, Dr. Zadonis, to take it away.
Well, I wasn't sure who you were talking about, but it has been an honor to have folks like you, Raghu. You've really made a difference in, anybody who mentors other people, and the kind of impact you've had, just like this community that's coming here to listen, and the people that you've brought on. It's just so impressive. And thank you for what you're doing globally and locally here now on the West Coast. And I'm sure people are from all over speaking. So we have an amazing panel, and I'm going to let them introduce themselves the way they do. But I think we thought we'd just start off with maybe getting a little grounded. Probably you've been running from one meeting to the next on Zoom or wherever you've been before you popped on here. So if you've done meditation before, this will be kind of easy and forward, but we'll just take a pause, get grounded, get to feel our body a little bit, and then we'll move into our panel. So I invite you all to find a dignified position for yourself. You might be sitting in a chair, or even standing or lying down. Just invite you to take a few deep breaths, inhaling and exhaling. Just settling into whatever's your usual breath. No need to change. Invite you to close your eyes or have a downward gaze. Just noticing your body, how you're supported by the chair. Perhaps your feet on the floor if you're sitting or standing. Just really noticing how your body's been feeling right at this moment. Perhaps some tingling, the breeze of the air. Perhaps even some pain or awkward feeling, just noticing it. I invite you now to notice your breath. Where do you really feel it as it goes in and out of your body? As you breathe in kindness, you notice it at your nostrils as it goes in and out. Perhaps at your lungs as they expand and contract. Perhaps at your abdomen as it rises and falls. Breathing in kindness in this difficult time of COVID. Breathing out peace. Where is your mind now? If it isn't on your breath, just bring it back. We're all humans. Our minds will drift. The practice of noticing and returning to your breath. Staying with your inhalation and exhalation. I invite you to think about a good friend of yours. See what images arise. Now imagine your friend has just told you they had a really difficult day. They're really upset about something that happened. What might you say to that person? What's the tone of your voice? What's your body language? What might you be saying or listening? Now I invite you to imagine that you had a bad day. Maybe you are upset about something you did. What do you say to yourself? What's the tone? Sometimes we see a gap in those two conversations. I invite you to say something kind to yourself. invite you to touch your body in some place, maybe your heart or your arm, perhaps holding your hands together, rubbing them, having a gentle touch for yourself, seeing what feels good for you. We can be so hard on ourselves, whether we're in recovery or just being human. So I invite you now to slowly open up your eyes. And in the spirit of COVID, I'm just going to have a little poem that I'm going to share with all of you. COVID sunset. Sunset in the midst of a virus. Silent as the birds fly by. Flapping wings and ocean breezes. A soft rhythm fills the sky. My heart longs for a safer time. To be held as a child who cries. A journey of 1,000 years, now living in an afterlife of love. Who was that soul from a century ago, who traveled on the winds of time? No clarity in the setting sun, just suffering swirls around. But gratitude for silent moments, real compassion all the time. Wandering across the oceans with no place to hide, a virus can't stop all motion with this chaos all around. Gives us moments for reflection, to grieve, care, fear, and hope. How did my life get so busy to let these moments fly away? A longing for connection, a longing for real peace. No one flies with the birds. Together they find their peace. Well, Raghu, thanks for setting this all up. And we have 3 amazing panelists, and I'm gonna just start with Carol and ask her to give us a little bit of an intro, whatever way she'd like. And each of them will get a brief moment for a couple minutes to talk about themselves and share a little bit about their story. And I'm sure we'll learn a lot more through this time together. Thank you, Carol.
Thanks, Doug. Well, I don't have the credentials the other people on this panel have, but I have been clean and sober for 34 years since I was pretty young. And I believe that's why I'm here. But also
that's more of a credential than
yeah, I have never had a relapse. I have never, and I'm still very active in the recovery community at 34 years. Right now in the era of Zoom, I co-host 9 meetings a week, which might be a bit much. But when we started all this, we didn't have any idea that it was going to go on and on and on and on. And Doug and David and I were talking, David M. and I were talking the other day about, it may not be optimal where the shift has gone now for sort of like 12-step recovery and Zooming, but it's better than nothing. And I have been in meetings every day since mid-March, and there are a number of people getting clean and sober in Zoom meetings, which is kind of mind-boggling to me because alcoholism and addiction are, or substance use disorder, or whatever you want. 34 years, the terminology has changed a lot. We can do the whole person first and all that, but I call myself an alcoholic. at any rate, you know, it's a disease of isolation and loneliness. And there's no more isolating and lonely time than right now. And we were talking about, you know, my worry is that there weren't enough resources before this happened. And an awful lot of people are, I know living in LA, I live in LA, that the amount of illicit drugs, because I still know people, and alcohol being consumed right now is just exponentially higher than it was. There are a lot of people just numbing themselves through this or partying. And my real worry is that people who may not have even had a really serious problem when this started are going to think it's a choice that they'll just stop it at the end, and they won't be able to. You know, I think there's going to be all sorts of carnage as this sort of ramps up and we go back to sort of whatever the new normal is. There are going to be even more suffering people, and the resources we had weren't adequate. So that's enough from me for now. I figure you're going to ask me things later, Doug, but that's kind of my take on things.
Thanks so much. And it's absolutely true. The numbers have gone up dramatically, almost 400% in use and in sales of alcohol, and tobacco use has gone up, and even in the recovery community. And I'm sure when we get a little further on, the participants may have some questions in that area, and we'll kind of field them. So David M.
Hey everybody, I'm Dave Marion. Today I am an interventionist, a national advocate for people struggling in recovery. I'm an author of a book I collaborated with my ex-wife, yes, my ex-wife, called Addiction Rescue, The No BS Guide to Recovery. We collaborated a book because she was a huge part of my recovery and my addiction. Unlike Carol, my path hasn't been perfect. I moved from New York City to come through Hazleton in '89, and I stayed clean for 14, 15 years. I'm a guy that played ball in college down in Florida, basketball, and had a bunch of knee surgeries. And I was a first generation opioid guy. And as soon as I got hooked on opioids, it wasn't long after that till I was hooked on heroin. And I had a very successful gold and silver brokerage firm in the Twin Cities. And I ended up bankrupting that. I got divorced from the woman I loved. And I was a guest of Uncle Sam in the only gated community up in Duluth, Minnesota for 36 months, 11 days, 7 hours, and 6 minutes. And through that, I found redemption, and I found my purpose. We often hear it said, the two greatest days of our life, the day we're born and the day we realize why we're born. And for me, when I tapped into the spirit of recovery again, I found my purpose, and my gift began to illuminate. Today, I'm on the front line fighting this deal. I've done 2 interventions already this week, and I'm constantly working with people and families to overcome the broken dynamics of the family. And what Carol said is so true. Addiction is a disease of isolation and loneliness. And the antidote is commitment to community. When we're living with an epidemic inside of a pandemic, the isolation and loneliness is beyond the wildest of our imagination. Numbers are staggering, like Doug was saying. Yes, online alcohol sales are up. Depression, suicide, domestic abuse. These are staggering numbers. Anxiety, fear. But what I'm finding also, anger is at an all-time high from this. So really, really grateful to be here on this panel, and thank you.
Thanks, Dave. That's great to hear the reality of recovery, and 2 steps forward, 1 back, and that is a common journey. And I'm sure at another time, Carol can tell a little bit more about how her journey started, because nobody's got a perfect life.
Yeah.
And I will
I
say
just,
this,
I just didn't drink or use. That's it.
Yeah.
like an old timer said in a meeting one time, how do you become an old timer? He said, don't drink and don't die.
Well, that's part of my story because my husband did die 24 years sober, and you can do anything and not pick up. You know, he lost 134 pounds while cancer devoured him, and I didn't drink or use. So, and because I was part of a community that supported me through that, I wasn't isolated and I wasn't alone.
But I think what both of you also bring up, probably for everybody who's on this call, you know, COVID does get us to take a pause in what's going on and really makes you have to take a pause and think about your values and how that influences your decisions and, you know, how you even consider things going well or not well in your life. And Dave, you really struck me with that, with what you were talking about meaning and purpose in life and how important that is for all of us. And David, you have an amazing book, a movie, all the incredible things. We're happy that you're here on the call today. So share whatever angle of the story you'd like.
Sure. Well, thank you for having me, and thanks for doing this. You know, as you were saying, Carol, it is a lonely time and people are isolated. And, you know, even in the best of times, we want to talk about a lot of things, but we don't want to talk about addiction. People are still, after all this time, even in spite of the opioid crisis that we've been living with, even the fact that we're, you know, still losing and burying 200 people every day, it still is something that, because of the stigma, we don't talk about. And now, it's, of course, we have to talk about COVID. It's a crisis, and there's no getting away from that. But it is sad that we aren't talking about addiction in the same way. As I said, we lose 72,000 people every year for the last 10 years plus, and so it is it's a tragedy, and I hear from so many people that this pandemic is making their lives harder. It is adding to the stress in their lives. Dave, I think it was you who said that you identified a feeling that I think a lot of us don't even realize that we have, and that is, and is one also that maybe we don't want to talk about too much for whatever reasons, but I've been realizing too that we are in this time and it's very confusing. We don't know what's going to happen next. It's scary, but also I do feel that anger that you're describing, and anger partly, I think, just because of the enormity of what's going on, but of course also the anger because of the stories I hear all the time of people who are addicted and people who are being lost here. And as much as the ability to connect online is amazing. I mean, Zoom 12-step meetings, I've visited some, and they're remarkable, and remarkable people come and share, and in some ways it's a revelation for some people I've heard who may be shy and it's harder to speak in a meeting, or even hard to get to a meeting. Suddenly it's like a house call. People are in their living rooms of their homes. But on the other hand, some people need that hug. Some people need to be in the room, and it isn't the same. And I feel like that's one of the real tragedies, and something we're going to have to figure out better, a way to be there for each other, for people who do need that, and especially people who are in early recovery. I'm here, my son became addicted when he was very young. He was a young teenager. He started using when he was 11 years old, and his drug use escalated to the point that he became addicted to heroin and methamphetamine and other drugs. And I almost lost him many times. I'm lucky. He just celebrated his 10th year sober, which is miraculous considering, there was a time when I didn't think he'd make it to 21, and now he just turned 37, which is amazing. And it also makes me feel really old that I have a 37-year-old son. But this brought me into a world that I never thought about. I never paid attention to. the world of people suffering because of this disease. And I've sort of devoted my life since then to try to understand it. What is addiction? You know, what is, you know, why can't people who are addicted just stop? And really connecting mostly to the people who are affected by the addiction. As I learned, and as anybody who's been there knows, whether it is you, you know, whether you're addicted or somebody that you love is addicted, it can consume you, it can consume your family, and it can just destroy your life. And then I guess the only other thing I'll say, and then I'll stop talking, which is that though we would never wish this on anyone, it is hell. There's no getting around it. Going through addiction, suffering from addiction, and we do lose. Carol, you talked about losing your husband, your ex-husband. There's no minimizing the hell, the horror, the stress, suffering that goes with that. But on the other side of that, you know, when there's life, there is enormous hope. And I see all the time, just as I know you all do, miracles happen. People who never thought that they could get clean, or never thought that their husband or their wife or their child or their parent or whoever it is could get sober and stay sober, do. And because we go through so much when we're in the throes of this, there's so much self-respect, there's so much introspection, there's so much connection with other people that's required. We open up in new ways, and I feel like the people that I know who are in recovery, they're the most amazing people I know. And they will all to one tell you that as hard as it's been, their lives have become something that they didn't even imagine it could be. And so I feel that way. I feel that my family, we had at our house sequestered, just because of the timing when all the kids were around, we had 6 people here for 10 weeks. And we either could have been like The Shining and somebody, I don't know, or, you know, we came through it the opposite. It's just everyone's closer together. And the part of it is the lessons that we learned through the process of addiction and recovery, about being open, about talking about whatever it is that's going on, about sharing our feelings and being supportive for one another. Anyway, thank you again, and Minds Foundation, thank you for doing this.
Yeah. Well, thanks, David. And I think your voice of families and what they go through, and seeing loved ones and not feeling like there's much you can do, lots of uncertainty, and you never know where it's going to go. I can really feel that in your love for your son. And the book, A Beautiful Son, that you've done is just so powerful. I think all of us have been affected in a deep way about it. So thank you for what you've done for the world. So we do know that substance use disorders, that there is a neurobiology, there isn't an underlying addiction, that the brain changes, the brain gets hijacked, people do things they wouldn't normally do under the influence, that different parts of the brain are affected, and you actually think differently and you respond to triggers differently. And you know, that's so important that, like other disorders, that we would have parity for coverage so that people could get the help that they need and want. And it's good that, you know, there's 12-step meetings for anybody to go to at any time, and have a recovery community that's powerful and helpful. But knowing that there's not one road to recovery, but there's many, and you never know where you're going to meet that person to come help them, and where they're at, and meet them where they're at. So sometimes people are met in prison and might get help starting in prison. And sometimes when I worked at Yale University, I worked with the chief of police there. We actually gave him little coupons, and we said, if you catch somebody early on, you just tell them, look, I'm going to arrest you next time, but why don't you go over to the methadone program and they can start you in that program. So there's methadone, buprenorphine, different medications. There's 12-step recovery. There's just counseling and support. And sometimes I had families that come to me and say, hey, I don't know what to do with my son, and I'd work with them. And so you never know where the window is, the door, and there are many options. And it is a real disease that affects people. And so I want to go back to Carol, and maybe you could tell us a little bit more about your journey before you got into help. And there might be somebody on the call who either has a little bit of a concern when they were where you were when that started, or where they may have a loved one who they're not sure what to do next. So maybe you could share a little bit more about when it was starting for you, and then what advice might you have?
Well, unlike a lot of people that I know in recovery, I did not grow up in an alcoholic home. I grew up in a really stable home. I was a top student. Everything was expected of me. I did fine until I went to college, and then all bets were off because, growing up, but David S. was talking about the stigma, I grew up in an Irish Catholic family and nobody was alcoholic. Nobody had alcoholism. I had a number of Irish great uncles who had the gout. They had the gout. They had to sit in the chair because they had the gout. But nobody was an alcoholic. So, I'm in my 20s crashing cars and ending up in places I don't know where I am with people I don't know. And I don't know what my problem is. I know I'm out of control. I know I'm partying too much, and I know that people like my parents would say things like, "You're such a smart girl. Why do you do such stupid things?" And I'd say, "I don't know, and keep moving like a shark through water, And here I am, I'm, in my early 20s, and I'm afraid to open my mail because lawsuits are coming at me for car accidents I don't remember. I lose jobs, I lose boyfriends, but I just keep moving, And fortunately for me, one day I came to and I asked someone I didn't know would know what to do for some help, a family member, and they got me help. And for whatever reason, even though I was quite young and there weren't a lot of young people, well, actually that's not true because I got sober in the mid 80s and it was starting to be sort of the heyday of the rehab. The care unit at Cedar Sinai was full all the time, and they would perp walk the people from the care unit up to the log cabin on Robertson Boulevard, which is really the place that saved my life. And anybody in LA will know this place. It is a funky old Boy Scout meeting hall. It had filthy floors, which they would tell you to mop with absolutely disgusting string mops. And I would say, this isn't cleaning anything. And they said, that's not the point. I learned to be of love and service right from the beginning. It was all about helping the person who had a day less than you. And so now I'm 34 years clean and sober. And believe me, I did not do anything perfectly, except I didn't get high and I didn't get drunk. I'm one of those incredibly lucky people that walked into 12-step recovery and realized what was wrong with me and that these people had a way to help me, and I stayed because I felt safe from myself. I would never tell people, I've helped people with really serious high dosage drug addiction problems and stuff. I would never tell them to just go cold turkey or something. I mean, you need medical personnel for some degrees of stuff. I was not so far gone. I was really lucky that I was quite young, and really only for 10 years did I drink and use to excess from day one until the last day, and then I stopped. As you said, I have great friends who got sober through 12-step programs who are extremely active in harm reduction, needle exchange, naloxone, handing it out of the back of their car. I mean, there's not just one answer. I'm just telling you, this was my path, and this is sort of the language I speak and that I know, but I'm not, would never say that one size fits all. I've had people that I mentored, sponsored, die of overdoses. And I have seen people homeless come out of the park and put together lives you would never believe. Never believe. We had a lot of homeless veterans living in San Vicente Park in the 80s and 90s. And a few of those guys came out of that park and you would have never bet on them. And they put together unbelievable whole lives. Astounding. My husband had trashed his whole life and put together a beautiful life. And yes, he died, but I'd be the first person to say, I've had an incredible, incredible life. People die all the time. It was terrible. I had 20 plus years of a great marriage to another sober person. I am blessed. Does that help at all?
Thank you. Absolutely. Thank you so much. And I remember as a young doctor myself, learning how to work with people in recovery. And I was at a meeting. I was running a group in Beverly Hills at a place called Matrix, and there was one of the patients. I couldn't even imagine, how did they even get into this? And he looked disheveled and just talked like he was just falling out of usage. And my co-therapist said, "Oh, that's the practicing pediatric anesthesiologist in the neighborhood." And it was one of those moments that you said, you know, really everybody, anybody this can happen to. And good news, the person had a really strong recovery and got back on his feet, but where you can't judge anything at whatever moment. And I've worked a lot also with homeless, and you know, sadly, about 1/3 of the homeless are veterans, and often they have mental health issues plus substance use. And getting back on your feet can be difficult, but recovery can be transformational. So thanks for giving that sense of hope that people can do better. I'm going to open it up to any of the panelists, any area that you want to add to, and then I'm going to see maybe from our audience, let's see if we can get a couple questions that the audience might either type now into the chat. We'll see how that flows, or even open it up in another way. But maybe just let the three of you have any other reflection or comment you want to have, and I'll start with Dave, and then we'll see what the audience has.
Yeah, you know, there was some good points brought up. Was
Dave,
it Dave?
Dave and David, sorry.
David.
Yeah. You know, something that David talked about earlier as well. The Zoom meetings, the online meetings, it's not the same. And I am seeing that coming in from all over the country. There is nothing like sitting in a meeting with somebody, the intimacy of them cutting their veins and opening it up to you and allowing them to have that physical connection is what's happening today. The current landscape we're in is a breeding ground for addiction, right? If there's what, 1 in every 3.6 Americans has one, how many more are cultivating new ones through this process? And that's the scary thing, that people are stuck at home. Are they binging on drinking, smoking, getting hooked to online gambling, porn, shopping, and things like that? That's the seriousness of something that we're really dealing with. How do we bridge the gap between this huge pandemic into a solution for the people struggling is the real, you know, conversation. How do we, you know, another conversation is, how do we work in a world where we have equal opportunities for everybody to receive the treatment that they need, not just because they don't have the insurance or the funds to do it. We have got to take care of the masses, because people are dying every single day on this. 70,000 a year. Fill up the largest stadium, football stadium, national football, professionals football stadium, and that's how many people are dying alone just from an overdose on the opioids. Not to mention alcohol is even more than that. Yes, this is a real problem that we have.
Thank you, Dave. David.
Well, you mentioned the Matrix program, and we're talking about Hazelden, and my son, over the course of the 10 years that he struggled to get sober, and he was both those places, and he also was about 10 other places. The point about that, I guess there are 2 points about that. One of them is that it's hard. It can take time. If those 10 years, I mean, Nick could have died at any point along the way. And so we were, as I said earlier, I'll say over and over again, and it's always present with me, how lucky we are. But it also shows, I think, going for 10 years and seeing, being in many treatment programs, seeing many therapists, also is a testament to me about how bad we're doing when we're trying to help people who do have addiction, who have a substance use disorder. When I look back, I realized that some of the programs and some of the treatment Nick got was good and was helpful, but a lot of it was useless, and some was actually destructive. Some of it was harmful. And I think that, and by the way, we're the lucky ones. Dave, you were talking about the people who don't have access to treatment, and so we got, we struggled, and people, over and over again, and things haven't changed over the course of the years. I hear it all the time. People go to programs, a lot of times for young people. We're talking about a young audience. Young people go into programs, they're treated terribly, they're made to feel worse about themselves. I mean, somebody who becomes addicted and whose life falls apart usually feels pretty bad about themselves as they start. And a lot of these programs are about punishment. It's about vilifying somebody who is sick. That goes to, I guess, Doug, what you were talking about, which is the importance of recognizing the fact that there is not one way for people to get well. This is a complicated disease and everyone's different. And one of the keys in our story, in our family story, was that it turned out that after 10 years of struggling and going sober and relapsing and being committed to staying sober and relapsing and over and over again, my son finally got in the hands of a psychiatrist who have diagnosed the fact that he had very serious bipolar disorder. And no wonder he was using methamphetamine and heroin and every drug trying to feel better. Because what would happen is he would go into treatment, he would feel better, he would feel clean, he would feel this elation at being clean. But then the highs of the manic parts of bipolar disorder or the depressive sides of bipolar disorder, he couldn't do it, and he was trying to feel better, and that's what it was all about. So part of what's missing from our treatment system is the recognition that so many people who do become addicted have other problems that are going on in their lives. Across the board, I would say everyone has suffered some trauma from their own addiction and from other factors in their lives. And we have to help people, whatever it is that is destroying their lives. And so to bring it back to where we are now, the question of what we can do for people who don't have access to treatment at all. I have been in touch with so many programs around the country, and they are struggling. Earlier you mentioned methadone programs, needle exchange programs, buprenorphine programs, clinics that see patients and do therapies and do feed people that are addicted and give them a place to live. I mean, people are suffering from all those. Some of them are figuring out ways to help. They're doing social distancing at this needle exchange program, and are helping people get into housing programs. But that's even trickier now. But they basically are, a lot of times people are putting themselves at risk because they realize that they're devoted to helping people. And sometimes that 6 feet doesn't work to help someone. And I guess the truth is I don't have any, and I don't know if any of us have any magic solutions here, and it's getting worse. It's getting harder to treat people because of the fact that people are isolated. People are stressed, and stress can lead to increased severity of addictions. But I guess the side of it that we all have to sort of say out loud, and that's really why we're here talking, is that we can't give up. We have to figure it out. And the first thing we can do is bring people together in whatever ways we can. And so that's why a conversation like this is great. And I hope that people who are here, who are struggling either with their own addiction, with a loved one's addiction, maybe it's not addiction at all, maybe just feeling depressed, maybe feeling isolated, really hopeless about the future. People are losing their jobs. What does this mean? How long is it going to go on? There are so many resources online. Search, suicide helplines, helplines for people who are addicted, all kinds of meetings. I mean, if people respond to AA meetings, there are AA meetings online, NA meetings, Al-Anon meetings, grief meetings. And it's a way to start, because it might not be perfect, but at least there is a way to connect with other people who understand, because we all are suffering, and the idea of communicate, I mean, it's a cliche of AA, and it's true, which is that the suffering that we do in silence is harder. And as my friend Annie Lamott, the writer who's in recovery, talks a lot about, when we, we can look at other people and it seems like they're all doing okay, but the truth is that no one is doing okay. We are all suffering, and openness is the start of a solution. And so I just hope that everybody who is struggling reaches out to someone, whether it's by phone, whether it's by Zoom, whether it's online, chat, whatever it is.
Thank you for sharing that very powerful message that you just shared, and about that there are resources for people to know, to be out there. I also wanted to thank you for talking about, caring for the caregiver, because right now, particularly people who are working on the front lines, it's a stressful time. And then those who are working in these in recovery programs, a lot of it's gone to telemental health, so everybody can always get help that way, in an outpatient way. The inpatient is now also getting better at testing. So we don't want to get to the point where also people fear going for help, which
That's
we're
right.
also seeing that they're staying away from programs. But I could tell you at UCSD, I know at UCLA and other programs, that there is extensive testing, so that they want to make the environment a safe place for people to get help when they need it now, and not delay and think something will get better, which sort of gets at some of what Carol was sharing about. I also just put in the chat room something that we've been offering for care for the caregiver, but it really opened up now for anybody. So anybody on this call we have now free online Zoom meetings every day, 5 times a day, to help with mindfulness and compassion. So if you like some of what I did with starting, we have a whole team of folks that are providing it. We're also seeing that people are living at home and there's more stress at home. So we have a program for couples, and then sometimes they have their kids at home and it's hard. Some of my staff say it's like driving down the road with the kids in the back seat, except they're not got a seatbelt on. So you're trying to watch the road and them. And so it's puts more stress also for those working. And then
when my son was here, just to interrupt quickly, when my son was visiting for those 10 weeks, I don't know, visiting is the word, but living here, quarantined with us, he goes to daily 12-step meetings, and he couldn't find a place to do it. He ended up on the floor in the bathroom with his laptop, trying to have a little bit of privacy while he was checking in with others in recovery.
I mean, I have friends who have young children who are trying to homeschool and be sober, and it is stressful.
Very stressful.
Yeah, this is a hard time for a lot of people.
Yeah. So how
and
can
the
we?
Idea that all I was going to say is, yeah, you mentioned earlier the uptick of people using, of people drinking, and you can't. I mean, it makes sense. I mean, stress, people a lot of people who become addicted have learned to deal with stress throughout the course of their lives. And suddenly I've talked to people who have been sober for many, many, many years and have relapsed. It's, I guess the first thing about that is to realize that it can happen, to acknowledge the fact that stress is out there, that we are stressed out as individuals and as a society, as community. And so we are at higher risk right now, and that doubles the point. It makes even clearer the point that we really have to watch out for ourselves, take care of ourselves, and ask for help when we need it.
Yeah, and Zoom is not, it's not a panacea. You will hear the people who are sober for years and years and years. One of the first things they say is, "This is all great, I need a hug." Skin hunger is a real thing. It is a medical thing. It's like the Romanian babies that aren't held. We all need touch, and we need that real community. And Zoom it's better than nothing. And there are people that come to our meetings from small towns, who really don't have access to things. We have people that come from all over the world and have become part of our community. It's going to be sad if and when we sort of disperse, to lose those people because they've really become a daily part of our community. But yeah, there's nothing like being in person and getting a hug and that one-on-one energy that David M. was talking about, where people are sharing their deepest, pain and shame, a lot of it. And people that relapse come back to these meetings, and nobody understands better than an alcoholic and an addict, people relapsing. Everybody's always welcome back. The person who relapse often carries the shame, but everyone's always thrilled to see someone come back and try again.
Right.
So Doug, we
Dave,
have a couple of interesting questions coming in.
Yeah. So that's why I was actually there's Dave, if you could read the one by Paul. He's sharing his journey, and he had some interesting ideas there. So while you're browsing that to give a response, I'm going to mention it. All right, go ahead and read it. Yeah.
Thank you all. I was a 12-step AA sober for 21 and a half years, from age 21 on. At 42, after a divorce, I conducted an experiment in moderated drinking, which failed miserably, and I ended up homeless and almost died from. I'm sober again and going to meetings a day and grateful to be alive. Speaking to what one of the panelists said about needing more public money to fight addiction, it seems to me that desperation, not money, is what's lacking. Can Congress pass a desperation bill can give every addicted person the gift of desperation and resulting willingness to change? Well, it's interesting. That's an interesting question, because last year I sat in the Capitol for 9 months in Minnesota, in St. Paul, with a team. And what we were doing is helping construct the first opioid stewardship bill in this country. And the reason that we ended up getting the bill passed is because bipartisanship came together for the first time in a long time to watch a Republican and a Democrat sit there together for the same common cause, that each of them had lost a son and a daughter to an overdose. We ended up passing this bill. Can Congress pass a desperation bill that they can give every addicted person the gift of desperation? There's a stigma attached to that as well. And that's part of the fight that we've witnessed. How do we shed the stigma of this? How do we get this into legislation and work with Congress to let every person out there come up with some type of comprehensive approach that everyone can afford the luxury of a treatment? If anything, for the detoxification and withdrawal, to have medical staff around them.
Thanks, Dave. And I do think, in some ways, how do people get that internal motivation, maybe as part of what the person was getting at, and whether it's desperation or, I think all of us who work in clinical hope that, you can catch people before a bottom and maybe elevate the bottom so the bottom doesn't have to be a disaster bottom. And so maybe feeling desperation at a lower drop than a real deep drop. Sometimes, as David comment, people with co-occurring mental health problems, depression, bipolar, that gets them into needing help sooner. And so I think those were both good comments for you, Dave. Thank you.
Just to add one more point, though, about the desperation. We all know that what this is like. You have to want this, like a drowning man wants another breath of oxygen. That's the desperation it takes, because you have to be willing to go to any length to recover, the same way I was willing to go to any length to get high.
Right.
And as a result, you don't see the willingness of many, and that desperation has seemed to dissipate through the erosion through the years. And that's what's happening today. Years ago, when Alcoholics Anonymous started, there was an incredible desperation there. Yeah. And to see what we're seeing today, I've seen it fall off through the years as well.
I'd add, if it's okay, Doug, if the problem that I hear a lot is, what do you do if you, as a parent, for example, I wouldn't know about that, but as a parent, see your child spinning out of control and you're desperate, but they aren't. They aren't because part of the disease of addiction, it's a brain disease. We expect people to think clearly and make decisions who by definition can't because their brains are not functioning, they're high. And I think that that we have to, Doug, you were alluding to this idea that, yes, there is a sense that people want to, many people who end up going into recovery hit some sort of bottom, whatever that is for them. They are desperate. They hit that desperation level. But they don't have to. What if we had a culture that we could shift so that we understood that people who are ill or addicted, just like we have an understanding that people have other diseases, we don't want to wait. We want to catch them as soon as we can. We want to hold them up. We don't want to get them to the point where their lives have fallen apart because then it's harder to put them back together. So how do we do that? It's really, really hard because this is a brain disease. But what we know is that we can. And sometimes it takes a family intervention. Dave M., you said that you do that work, and I think it's amazing. I think it's brilliant. It has an ability to get somebody who really does not feel that desperation or recognize the fact that they are dying, get them to get into treatment, sometimes even if they don't buy it. But maybe they're doing it for their families. Or maybe there's a little window where they recognize the fact that this is not the life that they want. Whatever it is that we can use to get someone to treatment or to make a decision for ourselves to get some help. When the question about desperation made me think about something I just read, and it also relates to everything we're talking about, the isolation of this disease. There is in England now a minister of loneliness because of the recognition that there is an epidemic of loneliness, and loneliness people who suffer loneliness are more likely to become addicted, more likely to kill themselves, more likely to die younger. And there is a nation that is recognizing that. We need a minister of loneliness. We need still somebody to lead our efforts in terms of addiction and drug use in America. The person who asked before about I guess, Dave, was also, you mentioned this idea of getting treatment to people that need it regardless of their socioeconomics. Everybody should have treatment. That's not happening. There are so many people who are suffering and struggling so badly who do want help and they just can't get it. And that's because we have a broken system and we have to pay attention. We have to fix it.
That's what I was going to say. You do interventions, but you do it knowing you have a bed somewhere to take the person to right then.
Absolutely.
And that's just not the case for so many people. There aren't resources to take the people to. And when we come out of this, there's going to be a bigger need than ever.
Yeah. Well, I want to address some of the comments that were sent to us because in a way they allow for a summary of where we're at also. One person wrote, and probably because we're connected with Minds, and they've been doing some great work in rural India where there aren't the resources, you don't have a high-end resource recovery center to go to. And I do think in a weird way, COVID is opening the door to normalizing things via Zoom, via telemental health. So there will be a much broader reach, and we do really need to think of communities that don't have even the minimal resources. But we have to do both. We have to have a system that does treat it with parity in a real way, and we have to think of those communities. How do you reach out to them? And one of the silver linings of COVID might be that we start thinking more broadly of how to get help out in those areas. So I also think that, we haven't used technology and all the other resources that could potentially be used. We could now do sensors 24/7, and really only if you're a doctor and trying to get in recovery do we track you and monitor you for your own good, and they do really well in recovery. So I think we've hit on all except for one last one, and then I'll see if any one of the three of you have a thought. what could workplaces and companies do to help people who are have a substance use disorder now, and maybe they're in recovery, but in those programs? And also, what about for family members who might be struggling during this time? So the question is, from a company point of view, what would you recommend to company people to do?
Well, first
I've
of all,
actually, I'm sorry, go ahead, Dave.
well, I was going to say, first of all, I was on a webinar this week with the EAP guys talking about how, these EAPs aren't being utilized as much as they should right now. It's a wonderful service. It's a free service for big companies that, 75% of them have EAP, and they're not being utilized at all right now.
What is EAP, David, for people who don't know?
Employment assisted programs.
Just for people.
Yeah. And they're wonderful programs. They're going to support you. They're going to give you the help you need. They're going to give you, get you to a secure place. And there is confidentiality involved in it as well. If an employee is struggling and you're watching the addictive behaviors in the office place, you're watching personality changes, you're watching the mood swings, possible variance in dress, not caring about themselves as much. And, it's something that needs to be addressed, but it's this pink elephant that no one wants to talk about, and it's something that every person has to take that part and be willing to stand up and say, I understand what you're going through. I see it. How could I help you?
David, did you want to add to that?
Well, all I was going to say is that everything goes back to the stigma when we're talking about addiction and mental health as well, broader mental health issues. We don't talk about it because we're ashamed, because we're afraid, because we feel like we're going to be judged. And so whether we're talking about at a company, whether it's a community, whether it's a neighborhood, whether it's a school, how do we get rid of the stigma? There actually is a very simple way to do it, and that is when we change a culture so that we no longer have to be ashamed and to hide what we're going through. And so if you live at it, I visited one of the biggest companies in the world. I'm sure actually it's something I'm proud of. I probably wouldn't care that I'm saying it, but I went to the main corporate headquarters of Chevron because of somebody who's at the very top of that company has been impacted by this. They have a culture that is extraordinary. And I'm surprised that it isn't more well known because it's a model for other companies. People have been given permission because the culture is open and recognizes the fact that people are suffering. People are suffering, whether it is with addiction, whether it's with a child who's suffering from an illness, whatever, that, if we suffer in silence, we're going to suffer more. We don't we think we're alone, but we're not. So the culture there is one of openness, acceptance. Nobody is punished ever. If somebody does, there's a culture that because they won't be punished, because someone's not going to be fired, they can ask for help. And the company has 12-step meetings at the corporate offices and their satellite offices. They have programs that anybody can go into treatment and recovery that needs it. They pay them while they're doing it. I mean, this is a cultural shift. The more we recognize that people who are addicted are ill, we start to treat people who are addicted in the way we would treat somebody else with another illness. If somebody has cancer, our hearts go out to them. We get them the best treatment that we can. And that's the way it should be with addiction. And it's hard to be too hopeful because of how many people are suffering. But I am a little bit hopeful because we're having conversations like this. The current pandemic has set us back. It's set us back as a nation and as individuals because of what we're struggling with. But addiction is not going to go away, and it is something that we have to continue to work on.
Absolutely.
Thank you. And I think I'm just going to add one last thing on this part with the businesses, because I'm sure we all see it. Leadership matters now, and value-driven leadership. And you can see different styles of leadership in our country. And leaders who value the people who work at that company, the ones who communicate effectively and let them know what options are out there for that company, the people who promote well-being and give people some choices. They create, like you said, a supportive, blame-free work culture, who try to help people to cooperate and help each other. I think these are some leadership aspects that company leaders have to pay attention to. And right now, I worry about the tsunami of trauma that might occur down the road with people stressed out. And what if this comes back with a vengeance in the fall? You know, we don't know what that'll be like. So I think probably like any earthquake or other disaster, first you move the rubble away and you treat infectious diseases, and then you got emotional trauma that lasts for a while. And the stigma problem will be a serious issue. It has been. I mean, in countries in the world vary by how much stigma they have for different problems, whether it's schizophrenia or heroin, and it doesn't always line up equally. But this is, you know, I think if anything, this COVID epidemic for me has just got us to appreciate a common humanity.
And
So
the other part
you're-
of that, I was just going to add, the one thing is that, you know, we've seen appalling behavior that comes out of this crisis, just like we've seen appalling behavior around addiction. But we've also seen remarkable people stepping up and helping one another. And this idea that it's true, you know, the 12 steps talk about service, you know, it does. And Buddhism talks about the suffering that exists around us, and that our own suffering diminishes when we recognize other suffering and attempt and do everything we can to alleviate that suffering. And that's something that we can all do now, and that's something that we can work on now. And no matter what happens, that's what we have to hold on to. We have to hold on to each other and do everything we can to support each other in whatever ways that we can.
And like Doug was saying, so many things have gone online. You know, I mean, I'm not here representing anybody but me, but LACOAA.org is the LA central office, and they have lists of online meetings. Al-Anon, you know, you can, I have lists of Narcotics Anonymous meetings in London. You know, anybody can help hook up someone that's looking for some kind of support. There is a huge community of people in recovery out there who are more than, you know, wanting to help people who are struggling.
And
they're meeting all languages.
Yeah, oh yeah.
Is that it's easy. I'm able to go to meetings with some of my best friends. I grew up in different parts of the country today. People in different countries are going to be able to tap into the Zoom meetings. And I think that's a really positive thing to bring once we get out of this pandemic. And I think that's going to continue as well.
Yeah, because you were talking about stigma. There's not the stigma in LA that there is in maybe some small town somewhere. You know, it's back in the 80s, it became a hip thing to go to rehab. If you guys saw The Player, right? He was going to AA meetings so he could network. You know, there isn't the stigma here that there are other places, but anybody can dial in from anywhere and get to a meeting. And it's phenomenal.
So somebody in the audience asked something that, you know, often when I'm referring a patient to a meeting, they say, well, somebody might notice I'm there. And I'm sure those of you who go to meetings may have a comment to that, but there are open meetings and closed meetings, number one. So even if you wanted to be a little bit more private, you can go to some meetings where you listen a lot. You could be there to learn in an open meeting versus a closed meeting. But the reality is, if people go there, they know they have an issue too. And it can be a very safe place. You know, movie stars might have to watch out, but Dave, you probably have an answer to that one.
They don't care.
They really don't. And I've done intervention.
Full of well-known people, you know.
I've done interventions on celebrities as well, and it's the same common theme. There's a brokenness about them that wants to get better. And once they get better, like we were just talking about, the more they make their lives about other people, the better they get to feel, right? And that's why they're open to working with others. If they really tapped into the spirit of recovery, doesn't matter who they are.
And I shouldn't speak, everybody doesn't care, but people who are sober a long time, who are well-known, you know, they're just a worker among workers, another sober person for the most part.
And they're one drink away from dying as well. They'll always tell you that. Yeah.
And you don't need to turn your video on all the time if you didn't want to.
It depends.
And,
some meetings do, because we had a lot of Zoom bombers and pornography and terrible, awful, upsetting images and racist comments, but only for a few weeks. Zoom worked with everybody to help us shut down the settings. We don't have that so much anymore.
Yeah, that's true. And I'm just going to mention, because when I started, we still have people in recovery with addictions, or people with mental health or addiction problems are half the smokers in the US. And it causes the biggest health disparity in America, which is to have a mental illness or addiction, and it's because of the smoking. And we need to do a better job there. Dr. Bob and Bill W., who were the founders of AA, both died of tobacco-caused diseases. And Nicotine Anonymous is available. It's online. It has many meetings all day, so you could easily go to one of those meetings if you're interested to learn more. But I do think as people are in their stage 2 of recovery, trying to take care of their body, noticing all the feelings, getting back in shape, that this is an important thing to put on that list that could really alter their life's trajectory. And so I just wanted to put a plug in for that as kind of that silent addiction when we're sometimes talking about the big ones. So Raghu, I know you had a goal of 6:15, and you said there was another person who you wanted us to close. This is an amazing panel, and I'm honored just to be a part of all three. I learned a lot today, and really just the authenticity drips, the realness of what they've gone through and sharing their stories. And I'm humbled to be a part of this panel. And thank you for putting us all together. So you said, Doug, you got to close them down by 6:14, and here we are. So I'm passing the baton over to you, and you get to close us out.
Thank you so much, Dr. Zadonis, and Dave M., Carol, David. That was amazing. And, you know, Tess and I, we were paying attention quite attentively, but we were texting each other as well about how amazing this has been going. And it's very powerful. And for me, some folks know that I started working in addiction back in college, actually, with a psychiatrist in New York, doing a lot of research to understand more from a biological standpoint how addiction is formed. And so I've had a pretty strong interest in this for a long time, as well as having some close friends, you know, having their own journeys. So mine started with this concept of stigma. And David, you mentioned what I completely agree with, which is how do you get rid of stigma? It's a simple answer: change culture. And for me, and for the ethos of Minds, that's what we try to do. And it's not, we don't need necessarily, you know, more digital mobile applications in the mental health and addiction space, right? For me, what we need is the answers that are already within us, which is getting people to understand that there are no boundaries for mental health and addiction, right? It affects everybody, like you all alluded to, bringing different stories. And we want people to understand that. We want people to educate, and we just want to educate them. It's not about, hey, you got to go to this recovery. It's you got to learn about this and understand it's a thing that can affect everybody. And it's discussions like this that I hope will really offer folks that opportunity to really understand that it can affect everyone, regardless of whether you're rich or poor, or if you're in India, you know, or England or the US. And the strength of community is something that I really try to preach, that I've learned from my work here in Los Angeles and abroad. You know, without it, healing can only go so far. And so as we're in this collective trauma that has caused a lot of increase in substance use, depression, loneliness. We have to really get together. And I'm really glad that as things are being taken virtual, Carol and David, you're seeing people from all over the world starting to have access to these services. And so I'm very excited about that. One thing, as I mentioned, storytelling for me is a very powerful tool. And with that, I had the pleasure of recently being connected with Alex Kaplan, who has his own journey, but also is a producer who recently moved to Los Angeles and launched a nonprofit film company called Of Substance, which, when I came across it, I completely fell in love with it because it does an amazing job of using storytelling as a platform to really get people to understand. So I just want to hand it over to him for, a quick minute or two, just to basically tell us a little bit of what the vision is behind it. And Minds is very excited to be potentially partnering with them as well. So Alex, I believe he should be coming back on now. And as he logs back in, there you are. Hey, Alex.
Hi.
I'll hand it over to you.
Thanks. Thank you, Raghu. And thank you to, I can't believe I'm here talking to everybody. Thank you to the panel and thank you, Dr. Zaidanis. As Raghu was saying, I'm a filmmaker and I'm also on my own journey of recovery, which led to creating Of Substance. Of Substance is a nonprofit film company working to overcome the blame, shame, and stigma surrounding addiction through quality short films. We make premium motion picture quality romantic comedies to thrillers and everything in between that about addiction, that are as immersive, entertaining, and enveloping as they are challenging, insightful, and vulnerable and authentic on some perspective of addiction. What we do is we're when you watch a movie or a TV show, scripted narrative cinema, and you get completely immersed in the world, you lose yourself in the characters. There's a magical ability that narrative cinema has to disarm audiences and allow us to emotionally connect and empathize with strangers and their worlds. This is a magical ability that cinema has that we're trying to harness in a different way. So Of Substance, our big dream would be to make a free Netflix of a perpetually growing collection of short films that anybody could go to anytime they need support, that a clinician could use at any point that they want to use this as a tool for therapy in a group or one-on-one setting, that goes into schools for general education. From elementary all the way through higher ed, that's going into programs for fraternities and sororities for prevention, early intervention, and long-term recovery, while also being an interpersonal communication tool. So imagine, right? I'm an addict who is trying to stay sober, and I'm at a barbecue and I have a trigger, and instead of having to leave for a meeting or call somebody or call my sponsor because I don't want to, I can excuse myself, go to Of Substance, watch this, God willing, Judd Apatow 4-minute comedy, and be like, oh wow, that was great. Oh wait, that's why I do it. I'm okay. And then go back to the barbecue, go back to work, but not before sending it to my mom and saying, hey mom, watch this. And mom saying, oh wow, that was great. Is that really what it's like for you? Yes, mom, that's what it's like for me. Because this film allows my mom an opportunity like nothing else to step into my own shoes behind closed doors and actually emotionally, viscerally experience what it's like for me. But then, because we tell stories from both my perspective and the loved one's perspective, mom gets to send me a thriller about what it's like for her every time I fall off the wagon and how it burns down her world. Now I see this and I can say, oh my God, I never realized what I was doing to you. Now we have an opportunity to heal. We're built on the notion that addiction is a disease of loneliness and isolation, right? And the belief that if you can improve someone's sense of belonging, you can improve their mindset. So we're in the business of creating community and an opportunity to connect. Oh man, I had all of these notes and I got kicked off and oh my God, We have no agenda. We know that there is no one road to recovery. Some people, 12 steps, AA, medication, doesn't matter. But what we do know, the one consistency across all of these methodologies is connection, right? The key to healing is human connection. And that's what our films are about. Our films are not about addiction. Our films explore struggle, the isolation struggle creates, and the power of connection to heal. And so that's why our films are relatable universally to anyone, because we believe that the human experience is a perpetual cycle of struggle and recovery. And so we're working to make recovery a more universal language for everyone. As we're coming out of COVID, we together as a society are in recovery. And you might even argue that right now we're going through our first relapse, if you think about it, by opening up as quickly as we might be. But I know I'm running out of time, or I'm way over already.
No, Alex, that was amazing. Yeah. Though. I think that, you know, I shared the link. I'm going to put it up online as well, but I really wanted him to deliver this as a resource, because I think right now it can really allow others to feel what it might be like. You know, even as a psychiatrist, I myself, when I work with patients who deal with addiction, it can get very challenging, because there's only so much I can say to help them, right? When they say, well, you haven't been through it. So there's a boundary there. And I think allowing us to have these tools can really help.
If I may, I'm so sorry. What I wanted to say is that what these offer is instantaneous catharsis, right? Like, films allow for us to connect emotionally within moments, which is what therapy is always trying to achieve. And so that's what these tools are. What we've created is a digital tool that's remotely accessible in a time of COVID or beyond, that people can use for their own personal support when they need to go, or that people can use if you're running a group. If you're running a meeting, you can bring this up, make this something that you're using as a tool, or that people are using in a clinical setting as well. We believe that this is the next evolution of education, but also support therapy for a digital age.
I'm just going to jump in. I'm going to jump in, and I have to be on another call in about 2 minutes. So I just want to thank you, Raghu, and all of you. It was wonderful meeting you and wonderful talking, and thanks for the work you do.
Thank you so much, David, for joining
I'm signing off.
And, you know, I think on that note, thanks everyone for joining us this evening or this morning, wherever you are in the world. I really am truly blessed and grateful and honored to have all of you joining us, and our panelists, Dr. Zadona moderating, and everyone sharing your story and tips and advice. It's truly amazing. And we will have more coming at you. So for folks who want to follow along, our website, mindsfoundation.org, you can check us out, Instagram, Facebook, Twitter, LinkedIn, all of the stuff online, and lots of resources coming towards you in the coming days and weeks ahead. And we'll make sure we're building out our resources a bit more online. And with addiction specifically, we'll be putting some more information up there, including some of the links to meetings that Carol and David and Doug mentioned. And we'll try to be creating some of our own videos and putting up some of substance videos up there in addition to that. So please look ahead for that. And we're right now working on some manuals focused on caregivers of those with addiction, because that's an area that's not addressed very well. But yes.
So Raghu, I just wanted to, because it's so cool that Alex came on and got, we should have had you earlier in the chat, because I do think care for the caregivers is so important right now. We started a peer supporter program at UCSD. We have 300 clinicians helping each other right now with the stress going on. And one of the coolest things, and this links to Alex, is we got lucky that there are a bunch of gifted actors who happen to live together and have their own studio. And so they created some amazingly powerful compassion videos that we're now using in training our peer supporters. And it's the most moving part of the training. And it's way different than a simulation center where you kind of train an average person off the street how to be a kind of problem. But the actors really have a talent, and they were demonstrating how to do a good, empathic, compassionate conversation. And these were ones that are so current with COVID crisis of caregivers worrying about going home and infecting their loved ones, and then some are dying, and how does the system respond to that? And when Alex was talking, I was thinking on multiple levels. Like, he's thinking about it for somebody who's in recovery. I'm thinking about it for breaking down stigma, because the power of acting and the power of the cinema to me is that it can touch people's hearts in ways that me at a lecture, I can't touch the heart the way the actors can. And they're so powerful. So I could also imagine, because Raghu and I share research ideas, so I could imagine studying whether this actually helps people or not, studying whether stigma could be reduced with people being exposed to these kind of real life examples, because there's the common humanity of the struggle. I could also imagine that we could see whether it could help clinicians, because they see stuff early on, and if they were catching things early too. So cool you came on, Alex. Raghu, you got to have him back and do another topic on this. And again, I just had to say it before we got, because I was so jazzed with what he said. And I also want to say thanks to Carol and Dave. You two are just amazing, and it was fun to work with you. And Tess, of course, you hold everything together. You're our glue. And so thank you.
Yeah, thank you so much, everyone. And this is the beauty of it, is that after these webinars, this is just the beginning of fruitful collaboration and relationships and building the community.